tonight. Flu shots put on pause.
And that they would contact me if they would contact me if they got more.
The Premier points the finger at pharmacies, but pharmacies say they're in short supply. Plus,
there's concerns about the possibility of it being within the ventilation system.
teachers at a Scarborough school refuse to work after 9 staff and 2 students test positive for COVID-19. And a big donation to support kids with autism is celebrated at a Toronto Children's Hospital. It's a shot that so many people want, but just can't seem to get right now. A major pharmacy chain is canceling flu shot appointments, saying they don't have enough of the vaccine. As Chris Glover reports, the Premier blamed the pharmacies for overbooking.
There's, over 600 people in this building every day. So for me, the flu shot is something that I've always felt was important to do.
With COVID-19 cases surging in the GTA, 63-year-old frontline teacher Laura Howe wants the flu shot more than ever.
Those are some factors that start to be concerning. So to me, it's just being proactive and doing everything that I have within my control, because so much is out of our control right now.
2 weeks ago, she booked an appointment for this Wednesday. Late last night, Rexall canceled due to lack of supply.
And that they would contact me if they would contact me if they got more. And
what did you think of that?
I was furious.
Far from alone, many complained on social today about last-minute cancellations from the pharmacy.
I don't think it's a Rexall issue. It's pretty much across the board.
Family physician Jenny Clement says doctors' offices are struggling with the supply chain too. But she says this vaccine vexation happens every year behind the scenes.
It's maddening, to say the least. Sometimes you get it when they say you're going to, and more often than not, you don't.
Today, Rexall said it's a province-wide shortage and to direct our questions to the provincial government.
Let me flip this around. Isn't this great news that we've seen an increase of flu shots of 500%? People are listening, and we're doing everything we can. As for Rexall, my friends in Rexall, you knew the allocations that you had, so don't overbook people. It's very simple as that.
You're sticking the human beings that need the vaccine in the middle between these two sides that seem to be pointing fingers at each other.
Laura Howe regrets booking a flu shot appointment in the first place.
The carpet was just pulled out from under me. I would have been better to have spent as much time as I could every waking moment trying to find somewhere, because basically I've lost 2.5 weeks.
The family physician I spoke to said as frustrating as these supply chain issues are, they're not a major concern, not yet anyways, and that's because the typical flu season doesn't begin until we're into winter. So as long as people are getting their flu shot by mid-November and kind of into the beginning of December, they should be okay. Chris Glover, CBC News, Toronto.
The Ford government is planning to increase the hours of direct care that residents receive in long-term care homes.
It will mean hiring thousands and thousands of new support staff. And this historic investment will make Ontario the first jurisdiction in Canada to commit to 4 hours of care.
The new standard of 4 hours of direct care was one of the recommendations released by Ontario's Long-Term Care COVID-19 Commission. The commission looked into the deaths of approximately 2,000 long-term care residents during the first wave of the pandemic. Right now, residents receive an average of 2.75 hours of direct care per day. The NDP wants to see this new standard implemented as quickly as possible.
If it's a priority, if it's something you really believe needs to happen, then it can happen much quicker than 4 or 5 years down the road.
More details on the plan for long-term care are expected to be revealed in this Thursday's provincial budget. Many major hospitals in this province are full or even over capacity, and it's not because of COVID-19 patients. That's raising fears of a return to the kind of hallway health care that Ontario saw before the pandemic. Our Queen's Park reporter Mike Crawley has the details.
As an overnight dusting of snow gives southern Ontario an early taste of winter, hospitals in the province are seeing patient volumes they don't usually get until December. That means there's not a lot of wiggle room if the number of patients with COVID-19 starts to spike.
The real fear here is that we see those numbers really get sky high and start to overwhelm hospitals through the fall and winter.
It is now time for oral questions.
The Ford government is promising an extra 2,200 beds for hospitals over the coming months.
Right now they are close to 100% capacity because they're dealing with COVID-19 cases, but they're also trying to catch up on the backlogs of surgeries and procedures that we had to postpone during the first wave. We don't want to have that happen again.
Figures obtained by CBC News show some hospitals exceeding 100% capacity. Among them, Ottawa Civic, starting construction on a temporary additional unit. Around the province, high occupancy rates and the demands of the pandemic mean many nurses are being asked to work extra shifts.
And I gotta tell you, they're weary, they're tired. How long can they continue to work at this pace and deliver the care that they need to?
St. Michael's Hospital in downtown Toronto has averaged 95% of its capacity since the 1st of September.
Our staff are stretched. They're working hard to accommodate our recovery efforts and meet the demand of those coming to us for care. It does take its toll over time, and people are tired.
Despite all this, the Ford government is considering loosening restrictions on COVID-19 hotspots at the end of the week.
We have to create a happy balance. If you go one way, it's not too good. If you go the other, it's not good. So we're doing pretty good as a province. That's what I can tell you compared to the rest of the country and the rest of the world. So we must be doing something right.
Although the number of COVID-19 patients has risen steadily since mid-September, right now they take up fewer than 330 beds in Ontario's hospitals. Mike Crawley, CBC News, Toronto.
Want to know how your local hospital fares when it comes to acute care occupancy rates? Head to our website and find out. We have the data going back to the very beginning of this year. It's all on cbc.ca/Toronto. Mayor John Tory says he supports the idea of reopening businesses that are currently closed under the modified Stage 2 restrictions.
I've also been working closely with Dr. Davila and with the province, including the Premier, to assist in the new development of a framework which can take us forward and find ways to open doors safely.
Toronto reported 315 new COVID-19 cases today. The city's chief medical officer says it appears the numbers in Toronto have plateaued. The mayor is urging people in the city's hardest hit areas to get tested. Tory says there will be more temporary testing sites popping up in the near future. Teachers at a Scarborough school today refused to work amid an outbreak of COVID-19. They say the school is unsafe with 11 confirmed cases and dozens of students in isolation. Ali Chiasson has more on the teachers' concerns.
Glamorgan Junior Public School teachers showed up this morning but refused to enter the building. Just as news of 11 cases of COVID-19 was too much for them to feel safe, it was too much for some parents too.
I'm pulling my kids out of school because not only just the news of there's an outbreak at the school, but because of the way the school's handled it. I feel really unsatisfied with the communication that I had with the school. Basically, I found out there was a case last week when my kids told me at the dinner table.
Isabel Zotten says there's been a lack of communication.
And then this morning I turned on my news and apparently their teacher's refusing to work and there's an outbreak.
9 staff and 2 students. 10 of those 11 cases were isolated to one wing of the school. The way teachers and their unions see it, the school's response is inadequate.
To close off one wing, the ventilation system serves the whole school. There's concerns about the possibility of it being within the ventilation system.
Toronto Public Health and the Ministry of Labour attended Glamorgan Junior Public School last week and gave the all clear.
Toronto Public Health has said that the school is safe. The Ministry of Labour was here last week. They said the school is safe.
The teachers obviously feel differently. None of them were working today. The principal was teaching classes with the help of vice principals from area schools and staff from the neighborhood YMCA. Despite the scramble to keep school in session this morning, the TDSB insists it was done safely.
So all the kids are in their own cohort, in their own classroom.
But how long can this go on? We asked Dr. Eileen Davila about why the school isn't shut down and whether it will be.
So there are a number of different circumstances that need to be considered, and really what you're looking for is, is there evidence of transmission per se within the context of the school? I think the other thing that's important to consider is, what measures have been taken and whether in fact the students have been at school during that point in time in their infection where they may have been infectious.
Right now, there is an ongoing and active Toronto Public Health investigation into the situation at Glenmorgan Junior Public School. But as far as officials are concerned, the appropriate number of students are self-isolating at home. There are about 60 of them. So school will be open again tomorrow. Whether or not the teachers show up is up to them. Ali Chiasson, CBC News, Toronto.
Police north of the city updated the investigation in the death of 15-year-old Bradford teen Ziem Zareski.
We know that the cause of death at the present time is from drowning, and we do not believe there's any foul play suspected in any way.
The teen's body was found in a pond not far from his home on Friday night. The tragic discovery ending a nearly week-long search by police and the community. While investigators say they don't know why he went to the pond, they say it was along a route he frequently traveled between his home and his aunt's house. Zareski went missing last Saturday morning. Police say the investigation into his death is ongoing. A big boost at a children's rehabilitation hospital will help support children with autism and their families. The $1 million donation to Holland Bloorview will go towards research on technology to help children with autism cope with anxiety. Kelda Yoon has more.
Susan Cosgrove and her 17-year-old son Liam have been receiving support at Holland Bloorview since he was 2. Liam has autism. Detecting and working through his anxiety can be a struggle sometimes.
Having to make decisions. That's one of them. Not knowing the answer to something and sudden changes.
Those are some things that get you a little bit anxious sometimes.
Yes.
A few years ago, he helped to test out an early version of a piece of wearable technology called the anxiety meter that runs on a smartwatch.
Basically reads your heart rate, and it goes up or down. Down means less anxiety, up means more.
Someone like Liam, he could read that watch, he could understand what it's saying to him, and then start to go through his process.
For Liam, the process is...
I find a distraction by finding something else to do. Like watching a video, like watching YouTube videos on my phone or my iPad.
In a virtual gala tonight, Holland Bloorview announced TD Bank Group is donating more than $1 million to help fund more research into technologies like the anxiety meter.
This is huge. The idea is that we can have these technologies that can be available to people at low cost in the community, in their schools, and at home.
Besides the anxiety meter, Dr. Azadeh Kushki is developing 2 other pieces of technology that can run on tablets and smartphones. One of them aims to help children with autism feel less anxious about going to the dentist.
We have a video, a 360 video that kids can interact with, and this basically shows the dental clinic, the clinicians that the kids may see, some of the dental tools that may be used, but also exposes the kids to the environment.
Finally, there is augmented reality to help with sleep training.
We have a virtual coach that can walk them through this sleep routine and help this make a little bit more exciting for the kids.
You're like a character, right, that is sitting there with them.
Yeah, so it's kind of similar to Pokemon Go.
It will make a big difference.
For Liam, but also for Cosgrove's 2 other children, Kaya and Phoenix, who are both also on the autism spectrum.
For a lot of children on the spectrum, people on the spectrum, and even people nowadays, it's easier to learn by way of technology.
Kelda Yoon, CBC News, Toronto.
After the break, we'll take you south of the border to the towns of Toronto, Kansas, Toronto, Ohio, and Toronto, South Dakota to hear how people there are feeling ahead of tomorrow's presidential election. Plus,
from November snow to a warm-up, I'm meteorologist Colette Kennedy. We've got one system in between the 2 things. I'll tell you all about that coming up.
From Toronto, Kansas to Toronto, South Dakota, there are a number of towns in the U.S. that share the name of our city. We wanted to find out what residents of these communities are thinking on the eve of America's historic presidential election. Greg Ross spent the day talking to some of them.
This is one of the main roads in Toronto. We're a pretty small town.
John Hubbard lives in Toronto, Ohio, which is one of the many swing states that could be pivotal in tomorrow's U.S. election. And with just hours to go, Hubbard admits he's still not sure who he's going to vote for.
I'm a procrastinator sometimes. I mean, it's a hard decision. I mean, it's a lot of stuff going on. This is Biggie's Pizza here in Toronto.
That's where Hubbard works, and as someone who is considered working class, he says right now he's leaning Trump.
He's made the economy better, a little better, in my opinion.
Well, Toronto, Kansas, it's about 242 people.
Debbie Schumacher lives in the tiny town of Toronto, Kansas, and there's no doubt who she's voting for.
I'm voting for Trump all the way.
And her reasons for voting to re-elect President Donald Trump?
It's crucial for the American people, for us to continue to be a nation formed under God.
And she says Trump represents her values, despite many well-documented moments like this.
You can do anything.
Whatever you want.
Grab him by the I can do anything.
We don't always speak correctly. We don't always have the correct actions, but I do think he was the man that God placed in this position at this time. I think the United States needed a businessman rather than a politician for a change.
Jay Sandys, who grew up in Toronto, Canada, and now lives in New Jersey, disagrees.
So I voted for Biden, and I voted about 3 weeks ago. I dropped it off.
And he dropped off his ballot early to make sure his vote counted after hearing Trump say things like this many times.
Voting by mail is wrought with fraud.
I made sure I filled it out correctly and did everything by the book. But even so, it made me nervous.
One of the biggest issues for Sandys is the pandemic.
His handling of the pandemic has been catastrophically bad. Just look at the rate of infection rate in Canada.
That was an issue for Jill Pearson as well, who manages a bar in Toronto, South Dakota.
I never really thought much about it. I didn't wear my mask a lot. I thought this whole thing was just a hoax, that sort of thing, until, like him, when he got it, he was like, oh my goodness, like, okay, maybe it's a thing.
And even though she likes Trump and has supported him in the past, she couldn't bring herself to do it this time.
To be honest with you, I didn't vote for either one of them.
Really?
Nope.
So who did you vote for?
I left it blank.
Who to vote for or who not to vote for is not a decision that most of us will get to make back here in Toronto, Canada. But there's no doubt many of us will be following every development as our neighbors to the south decide who will be in the White House after January 20th. Greg Ross, CBC News, Toronto. And we will have special live programming for you on what could be a very long U.S. presidential election night. The Nationals' Adrian Arsenault, Ian Hannamansing, and Andrew Chang start at 8 p.m., anchoring our CBC News reporters on the ground in the hotly contested states. That will be followed by a CBC News special after the vote at midnight. And it doesn't stop there. At 3 a.m., our CBC Morning Live team will be on the air, and that's all right here on CBC. A tease of winter this morning, our first little snowfall. People cleared off their windshields with frost advisories across the city. And Colette Kennedy joins us now with a look at the forecast. Colette, some people who maybe weren't happy about this will see some brighter days ahead.
Thanks, Talia. You know, we've got one little system that's kind of making its way through, and then after that, we've got a whole new weather pattern that's going to come in. So let me just walk you through this one over this next 24 hours. And really, it's through tonight and early tomorrow that it's going to have an impact on us. So as it goes through, yes, some showers in some areas. It is a bit of a mix with some wet flurries that we're seeing. Not a ton of precipitation, mostly north and to the east, but certainly we're still dealing with some of these winds, and in some areas still quite strong. So I'll tell you about a special weather statement there. Variable skies over Tuesday. What I mean by that, we're still going to have quite a bit of cloud cover in the wake of this system, but then we'll get into more significant clearing late in the day, but at times even during the day we'll get some sunshine in there. And then after that, we get into this pattern that's going to be almost a holding pattern, and we're kind of as long as you like some milder temperatures, we're going to be on the positive side of things as we get into a blocking pattern, and we're stuck in the warmer air for several days. Now, let me just deal with some of these winds, okay, and some of the peak wind gusts we'll be seeing overnight tonight towards tomorrow morning, because by the time we get to tomorrow morning, these winds will be easing, but it's right around the Niagara region that they hold on for the longest, right till tomorrow morning, and that's why you have a special weather statement there through the Niagara region, also into the Picton area because of those winds exceeding 80 kilometers an hour. But by tomorrow morning, things improving all around as those winds get lighter. There's sort of the cold front now associated with the system. The warm front kind of going through, and that's why our temperatures nearly steady or even going up and then kind of going down as we get towards the early morning hours. So temperatures a little bit all over the place with this. The precipitation fairly light, some of it a bit of a mix, mostly to the east and to the north of us. And then as that goes through, there's some of the cloud cover through the day tomorrow. So at times you get more sun, and certainly anywhere further west, you see lots more sunshine. We'll be seeing that into southwestern Ontario, and you'll have some of the milder temperatures with the daytime highs in the double digits because of all that sunshine you'll be experiencing. By the time we get to Wednesday, there'll be sunshine to go around, and never mind about the double digits. We'll be seeing that pretty handily, and those will be sticking around. But overnight tonight, your westerly winds here, winds are 3 degrees for that overnight temperature. I'm taking you to 13, so you'll add 10 to it for tomorrow afternoon with all of that sunshine. And tonight, again, kind of nearly steady. Then the temperatures will dip towards tomorrow morning. We go up towards 7 to 8 degrees. We'll get more sunshine later in the day that you can count on. And then there we go as we look ahead from Wednesday right through, and it's going to go beyond Saturday, folks. We're going to get about a week worth of conditions with temperatures way above seasonal. What a November treat we're going to see, Talia.
And I will treat myself to an ice cream cone that day. Thanks, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
It's that time of year when men grow a mustache for the month of November, and some local heroes are getting into the spirit.
Basically, we reach out to our friends on social media to donate towards our cause. And last year we lost to a small department out in Victoria. So this year, Toronto firefighters are definitely going to try to be #1 again.
Toronto Fire and Brampton Fire teamed up today to kick off the Great Canadian Fire Challenge, showing off their decked-out Movember trucks. Last year, more than 1,500 firefighters across Canada raised nearly $450,000 for prostate cancer and men's mental health. The teams are hoping to raise even more this year. And that's our show for you tonight. Thanks so much for watching. We have no show tomorrow night because of the U.S. presidential election, but you can tune into the national special starting at 8, tracking all of the results. Good night.